This is my ATTR 810 reflection on using diagnostic and treatment algorithms. My position behind the algorithms really is anything I can use to improve my patient care, I'll use. Whether this be diagnostic or treatment algorithms or clinical prediction rules, if me using these things as the clinician helps my patients, there's really no reason that I can see not to use them. And especially in the current culture of athletic training, if athletic trainers want to get away from the we have to know everything and fix everything ourselves, we have to not only use collaborative practice, IPE, IPP, but also these algorithms and clinical prediction rules. So I really see no problem using them in my clinical practice. Do I think that I'm going to have the printed algorithm in my hand while I'm evaluating or treating a patient? No. But I will use it as a reference and ensure that I know the branches of the intervention or the patient problems to ensure that I am providing the best care. So why will I not actually have the algorithm in my hand while I'm doing patient care? I think that kind of takes away from the patient interaction, and I think it would make my patients question my clinical judgment if they saw me relying on a piece of paper during my evaluation. Now, I think I could overcome that barrier because I did overcome that barrier in patient-rated outcome measures when I just had to simply explain to the patient why I had a piece of paper in my hand and why I was making them fill out this questionnaire, and now it's common practice in the athletic training room. So I think I could get over that that trust and clinical judgment barrier from a patient perspective. But I think if I study and I ensure that I know the information, I have no problem using the diagnostic and treatment algorithms. In terms of the treatment algorithm specifically, I guess my stance is that it's what we're doing as athletic trainers anyway. It just happens to be in a more organized manner in the form of a chart. We're using the best tests in terms of the best evidence, the best diagnostic accuracy. We're using the best interventions with the best evidence. We search for articles to improve our patient care, so it just so happens that this algorithm is in the form of a flowchart, rather than having to connect the information, synthesize the information, and then apply it to your patients. So I think that in the future, and as we get more comfortable with these algorithms and we make more of these algorithms, both diagnostic and treatment, I think it will only help my clinical practice. It will only help my patients. And making the shift from I'm an athletic trainer and I have to know everything and I have to have all the answers, if we can shift from that culture to a more collaborative approach with the use of the clinical prediction rules and the diagnostic algorithms, I think we'll be in a better spot, even for working towards third-party reimbursement, just being better at what we're doing and being better at the patient care that we're providing. So other than the trusting issue, I really see no problem implementing the algorithms into my clinical practice. And again, I plan to overcome that barrier if I do need to use the actual printed out flowchart in clinical practice. All it takes is a little bit of education in the terms of my part and making sure the patient understands that I do know what I'm doing. I did, make this information. I did make this algorithm. I did search for the information. So I think patient education can overcome that one barrier that I see.